Okay, I'm going to call the July 6, 2023 Health Committee meeting to order. We have 4 members present, so we do have a quorum. We have a consent agenda. May I have a motion? Motion by Johnson, second by Metzger. Is there any discussion? Hearing none, all in favor? Aye, I have to vote. Any opposed? Okay. Do we have any members of the public?
We have no requests.
Okay, thank you. Departmental matters, first up is Tim Wiley, Nursing Home Administrator. Hello, you have one item for action, request approval and agreement with Markham Accountants. May I have a motion? Motion by Metzger, second by Biles. If you'd like to explain this, or?
It's just an engagement letter for them to do our capital report for Medicaid. They do it each year.
Any questions? Hearing none, all in favor? Aye. Any opposed? Okay, you have your monthly report.
Yeah, you have the report in front of you. There were a lot of really good numbers from May. Excuse me. We hope to see that maintained for the rest of the year. We're still over 100 in our census. It's gone down a little bit. That's not uncommon for the July timeframe. But May was a really good month for us. We're excited.
Questions, comments? Member Metzger.
Comments. First of all, I want to acknowledge, I think the first 3 bullets in your report are pretty telling, and especially number B, and that is that 72% of the referrals are coming from local hospitals. We were getting none of those before. So whatever, I know that you and many people have been working on that, and even before you, there were people that were helping get that going, so that's huge. And the other one is the hospice unit, and I know how having 22 hospice residents is really providing a great service and putting some revenue into that stream also. So I just wanted to acknowledge those. And the last one is under agency utilization. That number has dropped significantly, and you and your staff need to be commended for that.
So I'd be happy to give you a sneak preview into next month's report. In the month of June, we eclipsed 30 people that we served on hospice. First time we've been that high in that number, and you're right, that's very mission driven. It's a part of compassionate care, and it's a major focus for us.
Very needed, and
Yes.
That's amazing. Good job.
A couple of the things I wanted to highlight. I was very pleased to see, especially after last month with the treasurer's visit, I was very pleased to see the numbers for this month, and I think for year to date, we are in the black, if I'm correct. That's through June or through
Yes. Yes, and a lot of that's timing.
May? Yeah, I know.
When you have annual invoices, semi-annual or quarterly invoices, in June, you'll see the expenses up a little bit, but it's because we had to pay quarterly health insurance premiums. But yeah, for year to date, we're in a good spot. And May was the month wherein our cash deposits exceeded $1 million, which was the first time as far back as Rhonda was able to recall. So that was exciting too.
Absolutely. And then the other thing is that as we're continuing to see the census creep up, I know that this is kind of our sweet spot for, there's probably still a little bit of room for more residents before we need to start expanding our staff. But can you remind me again what that number, where that census number is, where we'd be looking to hire extra people?
Actually, as far as CNAs are concerned, that should be a good number for what we're wanting our operational capacity to be. Okay. We have our licensure capacity, but that relative to our market share, and secondly, staffing that number would take away what we're offering our customers, and that is more more single occupancy rooms, so we've taken some beds out of service. Yeah, actually, the 105 to 115 number is going to be a really nice place to linger.
Okay.
And we hope to linger there. And actually, when we get closer to the 110, we added one more nurse per day. It was just 4 hours in the day shift, 4 hours in the second shift to try to be efficient there.
Okay.
But our CNA numbers will stay appropriate throughout its census growth.
Okay. All right. Thank you.
Do you ever find yourselves in situations where you have like a wait list so that we can maintain kind of ideal numbers?
We actually have a waiting list going for extended care. We have rooms that we have unofficially dedicated for rehab to home and rooms that we've unofficially dedicated for hospice, so we can keep those available for those types of referrals. And in order to do that, I think we have like 6 or 7 people for long-term care that are on a waiting list, which was another exciting milestone.
Yeah, I have to, like I said, last month, I think about the census being over 100, and you verified it was over 5 years ago. So I think that, we really are making a lot of inroads, and I think that your staff, please convey that this committee really does appreciate the work the staff is doing to them. So, not just to you, but I think they need to hear that too from us, so.
Absolutely, and just so you know my perspective, I tell staff this, they could function just fine for 3 or 4 weeks without me there. We couldn't function for one shift without them. And it will always be that way. And they are our product. That building is not our product. The furnishings are not our product. Our people are our product. And this growth, I attribute most of it to word of mouth.
That's great. And I also want to make a comment about the collecting on the aging, the in-house efforts on collecting on those aging accounts. So I think that that's good that we're actually doing it even in-house. And even though you have somebody that's working on it externally, that I think even the work that we're doing shows the commitment of the staff to keep that nursing home open and going. So.
And actually, the outside agency began their work in the month of June, and they are addressing 7, 8 months and older, and they've already generated close to $8,000 on those really old accounts that are much harder to overcome.
Great.
Yeah.
Thank you. Anyone else? Thank you very much. Next is Jason Tabb, Juvenile Detention Superintendent. Hi.
Good afternoon. I don't have any action items. You have my report for the month. If you have any questions, I'd be happy to try to answer them.
Okay.
By something. Can you help me, and I'm on page 15, under mental health services, and what's the definition of contacts? Not number of individuals, but so explain to me, remind me what that is. I know you've told us before, and I
Contacts would be
forgot.
the face-to-face meeting with the therapist and a resident. So these could be a number of different residents or a number of the same residents repeated throughout the time that they're there.
And so that's why your individual hours, for instance, March, you have 94 contacts. May, you have 100, but your hours are significantly higher in total individual hours in March than they are in May. So that would be some of the reason.
Yeah, it would be the amount of time she spends with each individual.
Okay.
Sometimes it's a quick meeting, how are things going, I'm good, I'm great, I'm fine, and the other times it's in-depth.
Okay, thank you.
Anyone else? Okay, thank you.
Thank you.
Next, we have Advanced Correctional Healthcare, JDC, or Jail Medical.
Hello.
Hey there. You have your monthly report. Is there anything you want to point out on that?
No, well, one thing is, after last month when I put some of the statistics and like the graphs in it, this month I found it a little bit hard to kind of give you guys like a month by month snapshot and for it to be easily understood. So I worked on it for a couple more days past when it was due. So next month you'll see, and this is kind of how it's gonna look kind of moving forward. And I have it all in Excel, so like each of the graphs that you guys saw last time, I think there's 1, 2, 3, 4, 5. So there's 6 of them. So each of those, I've kind of done it in like a spreadsheet, like year to date, so it's gonna give you monthly totals and then year to date totals. And then at the bottom of each one, I can just change the graph to kind of be either that date or if it makes sense to kind of keep it in like a bar graph kind of form. So I'm just trying to standardize it a little bit, so I do apologize that that didn't make it into this time. But definitely for next time and then moving forward. But I do have all of the spreadsheets for the data and all of the formulas in there in Excel for moving forward. And then really the only other major thing with us is we continue to work on some training with the nurses. So I've had the EMR, the people, our ACH corporate people who created the EMR system come in. They did some training. We even did some live virtual training for the employees that needed it that weren't on site that day. And then we have also done some more training like with our e-course system. And then kind of we have some new forms and stuff coming out where it's really going to be able to kind of track the data a little bit better and then give very patient-specific assessments to whatever their problem is, that it should cut down on any legal cases like moving forward. That way the nurses, if they're assessing for like a headache, you know, the assessment's going to drive them exactly what to answer, and that way they're not, you know, answering something and not addressing it on a patient-specific assessment. And then we're just training them if the patient comes in and says, you know, has 2 different complaints, that, okay, well, that's 2 different progress notes that are patients like specific. So that should kind of help the nurses, you know, improve their assessment skills. And then we'll just continue to work with them and improve the data. And the other thing I will mention is the budget. I feel like I'm trying to bring down some of like the cost of our supplies. And then I've started reviewing all of the pharmacy invoices. And so I've noticed that like the stock meds that the nurses were keeping on hand, some of them are extremely expensive, but the company doesn't allow us, once it's labeled stock, to send it back. And so I'm just going through the list of seeing like what do we really need to have on hand for stock, what could wait a day or two to be ordered patient specific. We are able to return anything patient specific and get a full refund on it, so that kind of makes more sense with that. And then also I'm working closely with the pharmacy to kind of notify me now that I have email on my phone, so they can email me any high cost med, and then nothing is being sent without my approval. And then just working with the doctor if there's something that I know, which is what I used to do when I worked at the nursing homes, I can get the doctor to agree to a different medication within the same, you know, if it wouldn't hurt the patient. So we're just kind of working on all of those things, and then supplies to try to cut down costs, but that's all really.
Okay, questions?
I had a quick question about the training for the EMR. Is that something that's going to be ongoing or just as needed?
So really, it should be ongoing, but it is going to kind of be on a case-by-case basis. So obviously, if we have more or any new staff come on, then they're going to need that training. It wasn't very in-depth that time, but I know in January, there's a new EMR coming out that the company built. And so then that's going to have to be very in-depth. It's probably going to be on-site training for more, like we did on-site training, but it was only 2 hours. So we touched on a lot of things. We took notes. I made little cheat sheets to teach them how to, in case they forgot. But I mean, for January, it's gonna have to be a lot more in depth.
So my assumption is that when they come in and do the more in-depth, that you'll need to have more staff, like per shift, so that the inmates can still have care while they're getting the training. I'm assuming that they're doing this on the job.
Yeah, so, well, as nurses, we get kind of clever and we are scheduling the trainings at downtimes. So
Okay.
sometimes we don't have an officer if the officer is on break or they have an appointment that day, so then we won't have an officer. And so really, it's just kind of coordinating what makes most sense
Okay.
to be able to shut down, nurse sick call, or doing it after we do the diabetic line when everyone's eating lunch. And then is it perfect? No, sometimes, if there's an emergency or something important, one nurse may have to step away. And fortunately, we do have a few nurses that have been with ACH company quite a few years and already know the system well. And those are the nurses that are coming on either part-time or full-time with me. So then they can, run the clinic, and, us that are newer can kind of still participate.
Good. I'm glad that you're thinking through that. I want to make sure that we are covering all our bases while we're getting trained. So thank you.
Yeah.
I have a question on, last month when Jackie was here, she was talking about the MAT. And has that begun? And then how involved are you in that? Because it's my understanding that Chestnut's coming in to do that, so they're actually doing the, injections or whatever, or whatever. I don't know how they're doing that. So that I just kind of wanted to know what your interaction is with that on the treatment.
Yeah, so right now it's me working with inmate services and our mental health provider. So what is going to happen, especially on Wednesdays, is when we decided that made the most sense for Dr. Nurse Carol to do this with us. So on Wednesdays, one of the nurses will be assigned to her. She will be with Tori to go over the kind of the huddle is what we call it, where the patients aren't there yet, but we're going to give the Dr. Carroll insight to each patient. And then the nurses, based on, whatever Dr. Carroll decides, she'll give us directions, but we've decided that one nurse is gonna stay with her just to make sure that everything is well understood. So, and then we'll do like labs after that. So like we'll do, and this is kind of our first protocol here. Well, we don't really use the word protocol, but it's kind of our first notes that we just finished from our meeting yesterday. But we'll do labs, and then after, based on the labs and like drug tests and different things like that, then we'll give those results to Dr. Carroll, and then the next week, the same patients are going to be seen again on Wednesday for the same program, and then on that day, we will start whatever treatment is prescribed. And then the nurse that is working with Dr. Carroll that day needs to stay with the patients, because she's kind of laid out for us certain medications the patients need to be watched for so many minutes afterwards. And so I think the medical department is highly involved in this, and I think Jackie and the inmate services are kind of doing a lot of the legwork minus the medical part of it, but we're all kind of working together and just trying to figure out what's the best route. And then also cost effectiveness is what I've been working with Jackie to make sure that the money in the budget and like the grants goes as far as it can go. So just pricing out like the drug screens, trying to figure out how many of those we're gonna need. And then also we kind of me and Jackie just kind of talked to Dr. Nurse Carroll about what medications and why we wanted certain brands and things and what would work best for our population. So, and then what to have on stock and not to have on stock was another part of the conversation. So, I mean, we're all just kind of working together, but just please understand there probably will be some kinks, and we're gonna just take it slowly. And then Jackie said to tell you guys she will be here next month, and she'll kind of go over more in depth. She kind of didn't want to answer a lot of questions yet right now until she had everything set in stone. So if anything changes in the next month, that's probably why. But
Thank you. Want to say something? Okay. Okay, thank you. So is that the number that are going to be treated, going to be counted in your reports too?
yeah, I think that I can find a way to put them in there and add it.
Okay.
And it would probably still be under the mental health part. And then obviously you'll see the numbers of like the withdrawals and different medications. Some of that might go up, but we'll probably just keep it in a different section. And then I'll just work with Jackie and to see, you know, what data she wants reported on, just in case she can't come every time.
Okay, great, thank
Or
you.
if there's something too specific that you guys want, just let us know, and, you know, I don't mind adding it in or starting to track it for you.
Okay, great, thanks. Anybody else? Okay, thank you.
Okay, thank you.
Next is Jessica McKnight, Health Department Administrator.
Hello.
Hi there.
Hi.
You have your general report.
I do. No items for action, just a general report, so happy to answer any questions.
Any questions? Catherine's going to probably talk about what we talked at Board of Health meeting.
Well, no, I'm not sure. I was just curious. You had your We Are Parents webinar, and you have really good results. How did you get the results? Did you send out a survey, and was that done by an outside party, or was that? So if you could explain that to me real quickly.
I do not know the specifics of the survey, other than surveyed of the participants, but I can definitely follow up for you.
Okay, if you could find that out. So,
Don't know how it was administered, what way we did that.
yeah, yep. And I know that this is the time of year for your environmental health, and so been to a number of those festivals and things, and nice job, because you know, you look around and you see they're following directions, so that's positive. So thank you.
They've been very busy and working very hard, so back to kind of normal.
Anyone else have any questions? Go ahead.
No, I think that was the biggest focus, the biggest takeaway that I saw and was about our environmental health, the hygiene with the septic tanks. And I was glad to see that we have a grant for the veterans to kind of get them off septic systems and onto where they were applicable. I think that is a big opportunity, and I don't know if you guys are working with the Veterans Commission on that, or if that's just something that you guys operate.
Yeah, so we actually do not directly have the grant, so
Okay.
not ours, but working with the
Okay.
entity that has that
Perfect.
as a resource.
Perfect. Okay. But I'm glad to see that we're utilizing it to make the lives of our citizens better. So thank you.
Anyone else? Done. Thank you. Next is Cassie Taylor, County Administrator.
Thank you, Chair Schaefer. I have nothing to report for this evening's meeting.
Is there any other business or communication? Our next meeting is Thursday, August 10th. Anybody have anything else they want to add?
Oh, I do have one more thing.
You do have one more thing. Okay.
At the Executive Committee next week, we will be introducing an RFP for brick work, tuck pointing and brick work at the nursing home to be paid for out of ARPA funds. This is something that was recommended by previous reports and something that has been deferred in previous years. So that work is finally getting completed.
And I think that Blue Room panel also made comments about that too, so making the building look nice, so. Anyone else? If not, we are adjourned. Thank you.